all happening during the 4th of July, in which fireworks are so deeply intertwined with that holiday, but also come with a number of safety and legal issues and precautions that must be taken. Earlier today, Valerie Quick, the director of the trauma program at UVA Health, actually sat down and did a Zoom press conference in which she discussed fireworks safety, holiday safety, and heat safety. We're going to listen to at least a little bit of this right now so that we can get some of those tips and tricks from Valerie Quick and maybe a little bit more insight into especially fireworks safety, how dangerous that can be, and how to make it through the heat on a holiday. Okay, let's listen in to UVA.
So, Valerie, I guess we'll start with 4th of July and fireworks. I know there are lots of events going on, but I also know there are some people who like to sort of DIY their fireworks celebration. So, what is your recommendation on the best way for people to safely enjoy some fireworks on July 4th?
Well, last year alone, there were about 13,000 firework related injuries that were treated in the emergency rooms in the United States, and about 15 of those were reported fatalities. Most of that, of course, happens during the 4th of July weekend. So, fireworks can be incredibly dangerous. Sparklers, which we don't think of as being very dangerous, those burn at around 2,000, almost 3,000 degrees Fahrenheit. That's actually hot enough to melt metal. So, these are not things that are things that really should be in the hands of experts instead. So my advice is just go to a professional firework display, enjoy that, and try to relax.
So you mentioned last year alone 13,000 injuries from fireworks across the United States. What are some of the most common injuries that your team at the trauma center sees from fireworks?
Most of them are going to be burn related injuries, but you can certainly have injuries to the eyes, the face, the hands as debris can blow up. And it really can be very affecting of people's eyesight. Very important to have your hands and your fingers all intact so that you can do those kind of activities. And with sparklers, we'll see burns, but also that the possibility of igniting clothing or other things. With homemade fireworks or fireworks that you get in the roadside attractions, you have to be very careful, especially at this time of year. It's very, very dry. And so that can actually ignite fires on the home. It can ignite fires with brush that's around. So you have to be very careful.
Yeah, looking at the state of my lawn, I would totally agree with that. Having said all that, we realize that probably some people will maybe not choose to follow your sound advice to go enjoy a fireworks show that is put on by professionals. So if people do choose against your advice to do their own fireworks display, what are some things they can do to reduce their risk for accidents and injuries?
The first is to make sure that you have fireworks that are not illegal, that you're buying reputable fireworks. The people that should light those off should not be young children. You want to have a responsible adult that is lighting that off one at a time. And that once you light them off, you take some steps back. Once those fireworks are lit, you don't want to relight those fireworks or get too close to check them out. You want to have a bucket of water or a garden hose handy. So anything that doesn't go off needs to be placed in that. And then afterwards, any sort of remnants are really doused down with water so that you reduce the chance of fire happening. If you have the chance to put some eye protection on too, as you're lighting that, that also is a good thing. And then most importantly, when you're lighting off those fireworks, you just want to make sure that you're aware of your surroundings. So any impairment of drugs or alcohol can lead to accidents.
We'll shift gears, and of course, again, for the reporters on, happy to take any additional questions you might have around fireworks as we move through the discussion. But also wanted to broaden this out a little bit. Again, 4th of July, kind of one of those quintessential summer events, and we're really in temperature or time of year. This is really kind of peak summer. So wanted to just see what kind of injury trends are out there, and wanted to start there. In the recent kind of weeks, months as we've gotten into summer, have there been any injury trends that you and your colleagues at the trauma center have noticed that would be good to highlight and make people aware of?
I think we've all noticed an increase of people utilizing e-bikes. They're becoming very popular in our area as alternative means of transportation. And these bikes are heavier and they're faster than regular bikes, and that reduces your reaction time to avoid crashes. You need to be following the rules of the road, and making sure that you are properly equipped for that. Because those bikes do go faster, we see a higher rate of head injuries and fractures and just generally multi-system trauma. If you're going to ride those bikes, you can't wear a standard bicycle helmet. You need to wear an approved NTA 8776 standard bike helmet, which is actually more protective, and goes around the entire head there. So that's also going to be really important as we move through this summer season, and as we see more and more people choosing to use those alternative means of transportation.
Beyond e-bikes, I know, again, summer is a time where people, again, maybe when it's not 100 degrees out, but when it's warmer, people tend to be outside more frequently, enjoying the nice weather. What are some of the traumatic injuries that tend to happen more frequently in the summer compared to other times of the year?
Well, we certainly see just a general increase of motor vehicle accidents. In fact, 4th of July, along with Memorial Day and Labor Day, are the three deadliest holidays of the year, deadliest days of the year. About 40% of that actually includes a driver that has an impairment of a blood alcohol level that is out of the zero point zero 0.08 range, or are under the influence of drugs. And so that is definitely more of a concern as people are getting out and about. The other thing that we see are lawnmower injuries. So we certainly see those accidents happen a little bit more. And that usually just happens for lack of awareness or improper use. You have to be very cautious with that. You really shouldn't have passengers along with you. It's really easy to take your child or grandchild along on the riding lawnmower, but we see a lot of falls that happen with that, and that will make it much more prone to having those blade injuries that can be pretty devastating. In general, children shouldn't be allowed to operate those push behind mowers until they're at least 12, and 16 for a riding lawnmower. But like with anything else, you want to make sure that you are paying attention to your surroundings, and that you're using those pieces of equipment the way that they're meant to be used.
You just covered a lot of my next question, but wanted to see if there's anything else you wanted to add around what people can do to reduce their risk of these common summer traumatic injuries.
Again, we really want to make sure that nothing is being operated like a motor vehicle or a bike, that isn't getting your full attention and care. So being distracted, whether that is texting on the phone or being under the influence of alcohol and drugs, is something that really needs to be avoided. And then the other issue is during the summer, we see a lot more water related injuries. So you want to make sure that you have somebody that is really watching that water. So especially for the 4th of July, we have big parties where everybody is at the pool, but nobody is really watching the pool. And those are often when drownings can happen. So making sure that somebody is designated to watch that water, that they're not checking their phone or reading or otherwise distracted. And that if you're at a pool and you can't swim, utilizing a proper water life jacket versus the little floaties, which aren't very safe. And then if you're on lakes or rivers, making sure that you again have those approved water vests, life vests, is also really key to reducing your risk.
We'll put out a call for any additional questions for Valerie about anything related to whether it's fireworks, summer safety, anything like that. Feel free again to email me or use the Q&A if that is up and running for you. But Valerie, I want to give you a chance to tell folks a little bit more about the UVA Health Trauma Center, and just a little bit about the services and the care that you and your team provide.
Yeah, again, UVA is a designated trauma center, a level one trauma center, and that's designated both by Virginia and verified by the American College of Surgeons. And what a level one trauma center does is that it is capable of really providing that full range of care 24/7. So from the time they get into the emergency department, to when they get their scans, go to the OR, ICU, acute care floor, and rehab, and just recovery. It's the full gamut of services delivered by specialized physicians, nurses, therapists, and people that really look at that full recovery from serious traumatic injuries.
And we'll give you one last opportunity before we wrap up here. Is there anything else that we have not covered yet, either about fireworks, about summer safety, e-bikes, anything else that you would like to highlight for folks?
We actually just started with the help of a grant from the Virginia Hospital Healthcare Association, a hospital-based violence intervention program. We call it RISE, which is Recovery, Intervention, Support, and Empowerment. And what this has allowed us to do is hire a social worker and two community violence intervention specialists that actually go at the bedside and take care of patients and support them that have been a victim of community violence, so gunshot wounds and stabbings. And what they do is provide safety plans and mental health and try to break that cycle of getting hurt again. They will provide individual case management after and mentorship, and then trying to link them up with community partnerships and programs so that you can help build that stability and move forward in a lifestyle that isn't going to be as you know, pigeoned in that violent state.
That's great. I know some of the folks from that program will be part of a gun violence summit coming up in just 2 weeks, July 16th here in Charlottesville. So we'll certainly be sharing more information about that as we get a little bit closer, and hope to see folks out there as well. So with that, it looks like we have covered all the questions for today. So Valerie, thank you so much for taking a couple minutes with us. I know some people have asked for it already. If you would like a recording of today's briefing, I should have.
Okay, back here in the Live Impact studio, a number of different topics covered there in that particular press conference from Valerie Quick of UVA Trauma, the Director of Trauma Programs at UVA Health.